Hello, and welcome to the Center for Fostering Success Best Practice, Best Fit webinar series. I'm Carrie Ward, Program Coordinator for Fostering Success Michigan. Our mission at the Center for Fostering Success is to improve college graduation and career achievement rates among youth and young adults ages 12 to 25 years old who are aging out of the foster care system. We would like to acknowledge our funders, the Kresge Foundation, the Havermill Foundation, and WMU for making this webinar series and all of our work possible. Today, we are pleased to welcome Dr. Megan Hayes Piel, who will be presenting Fostering Health, Addressing the Healthcare Needs of Foster Care Alumni. Megan Hayes Piel, PhD MSW, is an assistant professor in the School of Social Work at Wayne State University. Her research focuses on the physical and mental health of youth in and aging out of foster care. Dr. Piel's experience in social work settings includes providing interventions and program supervision for youth and emerging adults in behavioral health and foster care group homes and schools. The scope of her work is inherently interdisciplinary, as it focuses on interventions with foster youth and alumni involved in multiple service systems. Hi, Megan.
Hi.
Thank you so much for joining us. I'm just going to turn it right over to you.
Great. Thank you so much for having me, and thank you everyone who's joining the webinar today. I'm really excited to talk about a topic I think is really important and really intersects a lot of areas of well-being for foster care alumni. And the study that I'm talking about today really came about as a result of a collaboration, or really even just a conversation with one of our campus-based champions at Wayne State University, who was at our campus-based health clinic. And we were talking to her about how best to support students with a history of foster care, part of our program. She said, other than if there was a direct referral, she and her staff didn't really know if they were serving foster care alumni or how their needs might differ. So as a result of that conversation, we conducted a survey with the healthcare professionals at Wayne State and had a conversation, a dialogue with those professionals about how to meet the unique needs of foster care alumni. But at the same time, we also realized that we needed to hear from students with a history of foster care themselves to really understand their perspectives of physical health and healthcare services and some of the challenges and supports that were helpful to them in meeting those needs. So that, in a nutshell, is how we came to conduct this study. To give you a bit of background and some of the previous literature related to the physical health care needs of foster care alumni, many of you may have heard of adverse childhood experiences, and that these have a demonstrative, strong predictive relationship with various health outcomes. So most youth are exposed to at least one childhood adversity, but youth involved in the child welfare system are more likely than their same age peers to experience multiple adversities, such as physical abuse and neglect, economic hardship, parental substance abuse, and separation from family. So we know that nearly 80% of youth in foster care have significant physical, mental, and developmental health needs as a result of the previous trauma, as well as being involved in a system of care. So then it's not surprising that youth in foster care experience higher rates of acute and chronic health issues, such as asthma and diabetes. And beyond that initial exposure to social and environmental risk factors, adolescent youth are also more likely to engage in high-risk behaviors, with more than half reporting engaging in smoking, alcohol use, drug use, or unprotected sex. Further compounding some of these risk factors is the instability that many older youth in care experience moving around to different placements, which creates inconsistency in access to care, as well as management of their healthcare records. So we know that there's a longitudinal impact of these acute and chronic health conditions after youth turn 18 and leave systems of care. However, research has also shown that there are few engaged in healthcare services after turning 18. So some of the previous research has provided that foster care alumni may have difficulty accessing services due to inconsistent healthcare coverage or lack of relationships with supportive adults to provide some of that guidance in navigating services and systems. But there's really a limited knowledge of how emerging adults with a history of foster care understand physical health and services, which is what this study sought to explore. So our research question So what are the healthcare experiences of emerging adults with a history of foster care? And as I mentioned, the reason that we set up this study was really to look at those experiences of healthcare of students at a campus, university campus. So we wanted to specifically explore the challenges that may arise after aging out related to physical health, and identify how their history in foster care impacts their current health, as well as strengths and challenges surrounding their utilization of healthcare services. So we used a concurrent triangulation research design to really take an exploratory examination of their experiences with healthcare services. So we really took a broad scope in looking at healthcare and overall well-being. We used a convenient sample of 14 students with a history of foster care at a Midwestern university. They're between the ages of 18 and 25 years old. And we asked them to complete a 24-item survey of demographic information, as well as questions on service utilization and knowledge of healthcare services. We also conducted semi-structured interviews with all participants, asking questions about their overall health, access to healthcare services, preventative care, health insurance, and engagement with service providers. So jumping right into the demographics of our sample, as I mentioned, there were 14 students who participated in both the surveys and interviews. On average, they were 22 years old. Our sample was primarily female and African American, although we had one who identified as Latino or Hispanic, and 2 who identified as multiracial. We had a pretty even split in terms of part-time and full-time student status. And then when we asked about health insurance, the majority of our sample reported that they were currently insured, although 2 reported they were insured after turning 18, but not currently, and 2 reported they were uncertain if they currently had health insurance. We also asked about healthcare services utilized after the age of 18. So over half of the sample had continued to utilize medical doctors and dentists, as indicated by the light green and medium green shades on the pie chart. 4 had seen an optometrist or eye doctor, which is purple on your screen. And half the sample had been hospitalized, which is the yellow portion. And then the dark green, or the largest portion, where almost all participants were in the emergency room after turning 18. So 11 out of 14 reported utilizing the emergency room after the age of 18. In addition, half of participants reported chronic health conditions such as diabetes or asthma, and 8 reported having current unmet healthcare needs, most often related to finding a provider in their area or one who accepted their insurance. And some also reported lack of transportation to make it to those appointments. Half of the participants with unmet needs were in need of dental services, such as wisdom teeth removal or cavity fills, and other participants needed medical or vision insurance in order to fulfill their needs. So as I mentioned, the focus was on the challenges and supports in meeting their healthcare needs, but we also wanted to know about their utilization, specifically of campus-based health services. So only half of the participants in the sample had utilized campus-based health services. The others who hadn't indicated they were either unaware the services were available or they already had a relationship with a previous provider. So of those that had used campus-based health services, 3 reported using it for acute illness care, 2 reported using it for HIV or sexually transmitted infection testing, 2 reported using it for a physical related to their employment, and 1 reported getting immunizations there. So in addition to some of these questions about service utilization and insurance, we also conducted a qualitative thematic analysis of the interview questions to sort and review the major themes. And we came up with 6 overarching themes, which I'll discuss next. So the first theme that came up was really broadly related to attitudes towards seeking professional help for medical healthcare needs. There are both positive and negative experiences that impacted whether students continue to seek services. For example, the first one quote on this page says, "It was hard because it was my first time going there and I didn't know them." And then the other problem, "I was waiting 2 hours before the doctor even seen me. I only talked to them, the doctor, for like 10 minutes. So this experience of long wait times, in addition to just feeling uncomfortable and not being familiar with a professional, impacted whether they continue to seek medical health care. And then when we asked what was helpful, one student said, "The providers being really nice to me and letting me know that everything was going to be all right. They were very helpful because I was so scared and they were so good to me." So again, there was also positive experiences. Not surprising, students often talked about barriers to accessing services and strategies they use to access services. So the biggest one was lack of information regarding available services after exiting care, and some initial confusion about how to obtain health insurance and what it covered. So one student said, "If you're not properly informed about having health insurance, then you miss out." And there was an amount of years when I was paying for my own doctor, my own insulin. My health wasn't important to me because I didn't have the money to make it important. So this participant also talked about another issue. We know that healthcare is impacted by various other life circumstances. And when it comes down to, for example, paying for rent versus paying for insulin, that decision may not always be as easy as one might think. Other students talked about utilizing the emergency room. As I mentioned, the majority of students, 11 out of 14, had used the emergency room after turning 18. So this student said the emergency room, it's somewhat like a doctor's office, but you get in pretty fast. They do care, so they ask a lot of questions. So students consistently talked about the availability of getting into the emergency room and really only having to address their healthcare needs when they felt that they were really bad or debilitating. In terms of guidance and navigation of healthcare services and systems, ongoing support from mentors and campus-based support programs were consistently reported as being helpful in navigating those systems and services. One student said, reaching out to campus health, they were able to get my shot records by calling my old doctors, making sure I had everything taken care of so I could get back on track quickly. So some students talked about the campus-based health clinic being able to connect them to resources, and other people talked specifically about their campus coaches and mentors that they had prior to coming to the college campus. Another student said, I know that people are here to help me with trying to navigate around the healthcare services, and they helped me find the numbers and everything. So really that coordination of services, providing information was important as well. I think one of the interesting things that came from some of the interviews was really this insight that participants had, an attention to trauma and mental health, and thinking about how that was actually impacting their physical health. So several participants focused on that impact of trauma on their physical health, with one saying, I think stress it has a big impact on your health, because if you're stressed out and everything, you can't think right, and stress also affects your eating habits and everything. You get a lot of stress through traumatic events and being in foster care. So talking about how stress and anxiety and attributing overeating and weight gain to some of the stress and anxiety going on. Other students talked about psychiatric medications and adverse effects to their physical health as a result of taking medications for a long period of time. One student shared, there's a lot of misdiagnosis in foster youth. I was diagnosed with ADHD at 3 years old. Youth in group homes do not feel like they need the medication they are prescribed. It can have significant impacts on their health. It's putting barriers on people who already have so many. So again, I think these were some interesting quotes that came up, and it was a small sample of folks who were talking about psychiatric medications in this case. But these quotes are very insightful, I thought, in kind of connecting to the larger impact to health and well-being. And thinking about how some of their experiences in foster care impacted that. Probably the most common theme that came up was related to sexual health and family planning. All participants talked about this to some degree, and some really focused on the importance of getting information about sexual health and planning for their families in the future. And part of that, I think, is developmentally appropriate, just where they're at age-wise and the certain level of independence and thinking about families. But these participants are really insightful about how their previous experience impacted and the information they received impacted their ideas about family planning. So for example, one student said, I tell a lot of people my age, you can really plan out your kids. You know, unplanned pregnancy is 100% preventable. Others talked about having peers that are not educated and they'd like for them to have the information. And so talking about not receiving that information before they turned 18. And now that they really needed it, finding ways to seek it out on their own. Several students also talked about sexual health. Dating quite a few people, I noticed that I came out in a situation I didn't want to be in, and now I had to get tested. Then I had to let everybody else know who I was with at the time. So there was definitely very conscious efforts in being safe about sexual health and making sure that they're notifying their partners when things came up as well. And finally, there were several quotes that really talked about the impact of system involvement, or the indirect impact of system involvement. Specifically talking about having too many vaccines, weight gain due to nutritional limitations of food and exercise, sometimes being in residential care. The two quotes I have here, I've probably had too many vaccines. Being in foster care, your papers or medical records get mixed up. So they might give you the chickenpox shot 2-3 times. They're like, we don't have a record of it, so we have to give you this. The second quote, when I was younger, I was a little guy. And then from foster care, from ages 14 to 16, I blew up like 150 pounds and got diabetes. And I don't think that probably would have happened if I wasn't in foster care. So most often students were just talking about the inability to have a choice, necessarily in what they were eating and their physical activity, how many times they were vaccinated, some things like that they felt really impacted their physical health. So I think the study provides an exploratory examination of the knowledge and experiences of healthcare services for former foster youth. As I mentioned, it's a pretty broad scope, but I think it gives us some interesting things for future research. And also some strategies as practitioners and policymakers to really start focusing on related to the healthcare needs of foster care alumni. Consistent with previous studies, it was often brought up the difficulty in accessing services due to the inconsistent insurance coverage and our previous experiences with service providers. So students often talked about the positive and negative experiences, but also when they were engaging with other young adults with a history of foster care and kind of sharing stories to where they often gave service providers another chance if they had a different experience with someone else. Campus-based support programs, previous caseworkers and mentors were particularly helpful in making connections, giving them information about insurance and policies, and really moving beyond just the referral or case management aspect of this to trying to help them meet their individual needs. The emphasis on family planning and attention to trauma were the two big themes I think came up consistently from participants, just where they're at developmentally, but also I think very insightful in thinking about how these different aspects of their lives are really interrelated and overall impacting their well-being. I think it was also interesting that although campus-based healthcare services are available, only half of the participants chose to utilize these services. So these campus-based services may help address some of the ongoing or unmet healthcare needs reported by participants, but in some cases it was a lack of awareness or knowledge, and sometimes it's dispelling myths about what the healthcare services look like on campus. In terms of practice and policy implications, obviously I think actively engaging students in decision-making prior to the age of 18 is incredibly important. giving them a voice, helping them prepare to manage their healthcare needs independently, and also to think about the efficiency of healthcare services and how they're managing those needs. Program directors and policymakers may think utilizing the emergency room for regular healthcare needs is an inefficient use of services, but as a college student, that actually may be pretty efficient use of services that you only have to use when your healthcare gets really bad. You get in right away. You don't have to wait on approvals or referrals, things like that. So trying to help college students develop these problem-solving skills, finding the balance of preventative and ongoing health services, in addition to being able to manage their healthcare needs in an efficient way. Obviously, ongoing support for mentors and campus-based support programs is really important. And also moving, as I mentioned, beyond just referrals and services, but also related to dispelling myths of campus-based health and working through past negative experiences with service providers. I think also trying to meet those individualized needs, thinking about ways to engage students in physical health activities across campus, keeping them engaged in services and programs as it meets their needs is important. And then helping them follow up to those original medical records and some of the information on their medical history, because that often impacts the services that they received. I think professionals are uniquely positioned to advocate for policies and programs to support the healthy development and well-being of foster care alumni. Developing relationships with champions across campus and the health clinics as well as in the community is really important to be able to make successful referrals. And I think thinking about services and referrals eligibility that really meet the needs of that individual. If they're addressing chronic healthcare needs versus acute healthcare needs, those services may look different, things like that. As I mentioned, I think there's a need to increase awareness of preventative or ongoing health services. And then finally, campus-based services may help address some of the ongoing or unmet healthcare needs reported by participants. I think campus-based support programs are well suited to provide some of that support as well and those connections to services. So as I mentioned, it was a small study and I think gave us some good insight to things to continue to look into, as well as some strategies to help support foster care alumni. Obviously, it's limited in its ability, in its generalizability, but I think it provides some areas for more in-depth exploration on issues such as sexual health, mental health, emergency care services, and some of these other prominent themes that came up. I think at this time, that's the information that I have, and I'm happy to address any questions that you all might have.
So we're going to go ahead and open it up for questions. Attendees, please use the questions feature or the chat feature on the control panel to your right to ask Megan questions. Megan, I actually, on your pie chart that said healthcare services utilized after 18, the chart included things like doctor visits, medical provider visits, dentist, eye doctor, ER. And I noticed that it didn't include like mental health services or counseling services. And one of the things that I think was a big takeaway from our community collaborative on health and mental health was really like the stigma about mental health services with youth with experience in foster care. And so I was just curious if you could talk a little bit more about that and about kind of like the attitudes or responses that the youth in your study had for like counseling or mental health services.
So we didn't ask specifically about mental health. We were trying to keep it focused on physical health. Some of the other research that I focused on is geared more towards that mental health, but kind of as you mentioned, these things are intertwined. And even some of the participants, that was something that consistently came up where they were acknowledging, I know we're talking about healthcare, but actually my mental health is a really big factor in my overall well-being. One thing that I think helps in talking about things like healthcare as opposed to overall well-being or focusing in on mental health is that stigma. or avoiding some of that stigma. I think mental health and seeking mental health services and counseling, there's still a significant stigma attached to that, even though more and more people are utilizing those services. And I think it's becoming more commonplace. In talking about healthcare services, more people are often comfortable saying they need help with physical health things. And so if they often have anxiety, that's impacting their physical health. So they often go seek services to address the physical health needs that may actually be able to address some of their mental health needs as well. So I think there's some pros and cons in how we think about it and how we frame the overall well-being topic.
And then another question that I had, the impact of system involvement on health. That was actually a new thing for me, or a new thing that I hadn't heard about them having to have extra vaccines because medical records couldn't be found. And it makes sense. What other issues besides like additional vaccines or increased health issues such as diabetes were involved with that? Or did you hear additional concerns related to that?
So the psychiatric medications was one that got brought up by a few folks, and different adverse effects of those, but most often talking about weight gain and diabetes. Others talked about glucose pills or medications that they were taking for diabetes, and felt like the research that they did on their own about those medications was having more of a harmful effect than they felt like it was helping them. I think the medical records piece was one that came up for most folks, either not knowing their medical history or just not being able to access those records as they'd move from placement to placement and switched agencies or providers, different things like that. So I think some of those things really compounded their experiences in the system and with their overall health care.
Okay. Okay, you kind of already answered this with my first question, but I'm going to go ahead and read it anyway, just in case you want to talk more about it. In the design of your study, did your team intentionally decide not to include mental health? And if so, why not? As a result of the study, noting participant emphasis on mental health, will you consider including mental health care in your assessment of foster alumni healthcare needs moving forward?
Absolutely. As I mentioned, a lot of my previous research has focused on experiences specifically with healthcare services. But as with any of these life domains, we know that they all intersect. And so part of that intentionality in trying to focus specifically on physical health was to try and unweave that a bit, or I guess differentiate some of those things. But I think the results of the study just further speak to the need to address overall well-being, and that really does include mental health and how that impacts physical health, and physical health impacts mental health, and how all of those really impact success and education and employment, and thinking about how all of these things impact each other.
Another question we had, are there other specific strategies practitioners can implement to support the healthcare needs of students with a history of foster care? Did I lose you?
Nope, I'm here.
Okay, good.
So I think moving beyond referrals to try and put out accurate information and making sure that information is readily available. I think sometimes we don't always give young people the info they need at a time when they really need it. So even if they may have received some information prior to aging out of the system, if they hadn't encountered a significant healthcare or mental health need, they may not remember that information or how to access those services or even re-enroll in insurance. I think another important thing is connecting students with other former foster youth. I think it not only gives them a chance to connect with someone who understands their background, but also engages them with someone who may have had a different experience with a service provider or someone who's able to support their broader well-being. I think I may have mentioned earlier incorporating physical activity or outings as part of campus-based support programs or activities in addition to just trying to develop independent living skills or study skills. I know, for example, in downtown Detroit, we have those bikes you can rent. Sometimes they can do like a scavenger hunt around the city or something to give people a reason to be more active rather than sitting and listening to a presentation.
Another question, your study was of college students with access to a campus-based support program. Do you think the experiences of former foster youth would look different if they did not have a campus-based support program or maybe even were not enrolled in post-secondary education?
Certainly, I think their access to information and services would be impacted without the additional support of campus-based programs. But I think it depends on their broader support system of mentors, previous caseworkers, people they feel like they can reach out to for information. I think most programs focus on healthcare and physical well-being as part of the life domains. And I think four-year universities have clinics that provide a variety of services and can most certainly help them navigate insurance-related issues and referrals. But it seemed like in this case, there were some misconceptions of many students as the limitations of healthcare services on campus, and that they thought they could only go once a year, or they wouldn't accept their insurance or things like that. So I feel like there's room to kind of broaden the awareness to be able to utilize some of those services. And I think even if community colleges have campus-based support programs, there often aren't standalone healthcare or mental health services available. So I think the connections and referrals are especially important with those programs.
Another question, how do you plan to utilize the results of this study in your work moving forward?
I'm definitely excited about the directions that I can head with some of this research. As I mentioned, I think we took a pretty broad scope, knowing that we weren't going to be able to dial in on one specific area with this initial study, because we weren't sure what was the most important to foster care alumni in regards to their physical health, and we didn't want to focus on an area that wasn't important to the majority of participants. So I think digging in on some of the information that we got related to sexual health and family planning, obviously mental health and supporting mental health is a big passion of mine in terms of research, and I think just looking at how some of these ideas are interconnected to be able to move forward. I also think we'll come back around to working with the campus-based health clinic staff. As I mentioned, this study kind of came about as part of a collaboration as we were working with nurses and doctors on the campus-based health clinic side to really help them understand how to best meet the needs of foster care alumni. So I think we may circle back around and do some work with campus-based health clinics as well.
Okay, it looks like we don't have any more questions, but I want to give you an opportunity to answer this final question before closing, just because I think it's important to summarize the whole thing. Why do you think addressing the healthcare needs of this population is so important?
I think the results of this study and then thinking about some of the previous research really point to the idea that health has such an impact on so many other parts of our lives. Stress impacts our health, as does living conditions and family relations, which all impact our ability to succeed in education and in employment. I think if there are unaddressed chronic health issues, that impacts our ability to work, which can have a ripple effect in our lives. So starting to think about these issues as being really interconnected, I think helps us be able to provide better supports and services to foster care alumni, both on college campuses as well as those who are in independent living situations too.
Absolutely. Okay. This is Megan's contact information. If you would like to reach out to her, if you have any questions that come up for you following the presentation, a recording of the webinar will be available on our website this afternoon. Megan, I want to say thank you so much for joining us today and sharing the results of your study with us. I really appreciate it.
Thank you.
Also, a PDF version of the PowerPoint is also available on your handouts on the control panel to your right, and will also be posted on the FSM website page with the recording. Thank you so much, everyone, for attending the Center for Fostering Success Best Practice Best Fit webinar series. Please visit our website for more information. And if you like this content and would like to see it continue, please donate today by visiting our website. Have a good day.